We're all about conflict at the National Conflict Resolution Center, and we've been working in this field for over 30 years. There is conflict in all aspects of our life, and we see it, in our families, in our communities. We see it in the government. We see it nationally and internationally. But as an organization, we have been increasingly focused on healthcare. Because healthcare, we find conflict to be so prevalent within hospitals and within clinics. And the impact of conflict is so severe. A story that just occurred the other day, I was meeting with a chief medical officer, and he was telling me that he still remembered 30 years ago when he was a resident. And he said that he was in a surgery room, and they were looking at this body, and the inside there was a lot of swelling, and the lead surgeon was just about to cut the urethra, and the resident knew that he was cutting the wrong tube, but as a resident he didn't feel that he had the confidence to really speak up. And so it's this hierarchical decision-making that happens in the hospital that really closes out a lot of the voices that you hear that should be heard. Miscommunication in another company, or conflict exists in a different organization, what's the result of that? Maybe a lack of productivity. We're not talking about the consequence of a patient potentially losing their life. Let's go into a hospital system and think about what are the types of conflicts that exist within a hospital. And let's just take the example of a nurse. The nurse is in the middle. She or he is working in a high-stressed environment. And the nurse is getting pressure from different points in her daily work. She has the pressure from the physician. Sometimes the physician has a very strong point of view. There are some physicians that might be considered disruptive physicians, high conflict personalities. The nurse needs to interact with that physician on a daily basis. Then there's the patient. Like we said before, these patients are coming in, they're very stressed. Sometimes they actually exhibit high conflict behaviors, not because they have high conflict personalities, it's just that they're in so much pain that it alters their personality, and that challenges the nurse. So not only is the nurse dealing with the physician, but now the nurse is dealing with the challenging patient, which also sometimes puts the nurse at risk, talking about worker safety and how, what protections are in place for the worker as the worker, the nurse, the frontline staff's interacting with the patient. And then on top of that, there's the colleagues. What if a nurse has a different point of view of another nurse, a different nursing style? This is another point of conflict. So here you have a worker, in a high stress environment dealing with all these different issues. And how is this typically handled in a healthcare environment? It's handled poorly because what typically happens is that it's avoided. No one wants to deal with these issues. People tend to avoid conflict. They walk in the other direction. An example of a surgical team, typically before surgery there's a pre-op meeting, and the physician and the nurses meet together to discuss the surgery before it actually takes place. Well, in this particular hospital, there was so much conflict between one of the lead doctors and a nurse on the team that the doctor refused and the nurse refused to actually interact with each other in the pre-op meeting. So what happened was that the nurses all met together, and then the lead nurse met with the physician before the surgery occurred. Well, if I was a patient going into surgery, I would like my whole team to be meeting together, not to have this divisive situation occurring. There's great cost to this type of conflict that we're seeing in healthcare. There's great cost to the individual. facing this type of pressure day in and day out, impacts their morale. It makes them less productive and increase errors. A graphic we often use in our training where it shows it's a bell curve of anger, and as anger increases, the decision making decreases. So you get at the point where, at the highest point of anger, you have the least ability to be rational. And it's at that point where you're frustrated where all these errors and challenges actually occur. And then it's the constant dealing with this type of pressure that eventually leads to health concerns in the healthcare provider. It leads to burnout. And then eventually the nurses or the doctors, if it gets to that point, they'll just end up leaving the hospital or just leaving the profession altogether. What's the cost to the organization when that occurs? If it escalates to a point where there's actually a lawsuit, some of these suits can be up to $250,000 to try to resolve. And then the replacement cost to bring in a new nurse to train a new staff person, it could be up to $100,000, and that's actually getting more and more challenging. There's some predictions by 2020, there's going to be increase of need for staff by 25%. And over 1 million nurses, registered nurses will be needed, and 250,000 doctors. Given that situation, how are you going to attract physicians and nurses to your hospital, if there's a culture of disrespect? This is what needs to change. And then there's productivity loss. I mean, what is the cost of loss of productivity? I mean, we can't even figure out how big that number really can be. Fortunately, there really is a solution to this conflict in healthcare and the miscommunication. And what our focus is at the National Conflict Resolution Center is early intervention. Let's not avoid these issues of conflict. Let's come up with an integrated system to try to deal with these issues before they escalate, before the nurse ends up leaving the hospital system, before the doctor becomes so frustrated, before the patient lashes out at the frontline staff. We've come up with 3 levels to try to address this issue. The first level is one-to-one, teaching basic communication skills to the frontline staff. Then the exchange is a second process. It's an informal process where managers and supervisors in a hospital can address conflict in a mediation-like process. And then there's the more formal mediation process. So you have 3 levels before the issue really spirals out of control. Level 1, what we train, it's the art of communication. And what we're doing is we're giving communication skills to the frontline staff to empower them to get the matters resolved before the issue really escalates. Going on to the second level, the exchange. That's what is the focus of our book. And it's an informal process for managers and supervisors throughout a hospital system to effectively manage conflict. So in the situation with Simon and Yvette, you'd have the nurse manager meet with each one of them separately and then come up with a plan to try to work through the resolution. What's exciting about it is that over time, the person who's running the exchange, they're not neutral like a mediator would be. They have a stake. They have to make sure that whatever Yvette and Simon, whatever they decide, has to fit in with the policies and procedures of the hospital system. So it's an informal way to try to get at this conflict before it gets to the next level. The final level is mediation process. I think many of us are familiar with that. And this typically in a hospital system happens out of the HR department. And typically they're either in-house mediators or they bring in external mediators to help facilitate the resolution before it actually ends up in the court. So we think about it as an integrated conflict management system for a hospital. Early intervention, all of these levels to try to get at the issue, to try to resolve the conflict before it really escalates and gets out of control. And there are a lot of benefits. Less stress, less medical errors, less turnover. Morale goes up, productivity goes up, satisfaction, and most importantly, the culture. We were talking about the culture of disrespect. Through this type of system, we now have a culture of respect. And that's what's going to, really move the whole system forward and move us from really conflict to collaboration.